Hey guys, this is Dr. Hub. Today we'll look at the prevention of parent to child transmission. So in terms of this, the HIV counseling and testing for all pregnant women should be done. So HIV counseling is a must and it should be done, and testing for all pregnant women enrolled in the antenatal care. So in terms of the enrollment in the antenatal care, so in such cases they can have a opt-out option as well. So there is also something known as the opt-out option which can be availed. So what is a lifelong ART? What does it constitute of? The lifelong ART, it contains the tenofovir. So there is something known as the tenofovir. So tenofovir, that is TDF in short. Then there is lamivudine. Lamivudine is 3TC. Then comes the dolutegravir. So what is dolutegravir? It is written as TTG. That is dolutegravir. So all these are given. They are administered to all pregnant and breastfeeding HIV infected women. So in terms of all pregnant as well as the breastfeeding women, HIV infected women, regardless of the CD4 count and clinical stage. So you don't consider the CD4 as well as the clinical stage. So there are institutional deliveries of the HIV infected mothers. Next is a care of associated conditions are taken care of. So what do you mean by associated conditions? So it can include the STIs, the RTIs, then there may be TB, there is opportunistic infections, there's hypertension as well as the diabetes. So there should be exclusive breastfeeding counseling, and the plasma viral load. So this testing is done at the plasma viral load testing is done at about 32 to 36 weeks. So it is done at 32 to 36 weeks, and this is of gestation. Weeks of gestation to determine the risk of HIV transmission to the baby. So what it does is the HIV transmission to the baby. So there are initiation of ARV in babies. The initiation of the ARV in babies. So in terms of the low risk infants, so we are naming them as LRI, that's the low risk infants. So in low risk infants, there is a syrup, nevirapine. So nevirapine is from birth till 6 weeks of age. So it's from birth till 6 weeks of age. Then comes the high risk infants. So here again it is the syrup nevirapine. So nevirapine is given and it is combined with the syrup zidovudine. So either from birth till 6 weeks of age. So it is either from birth to 6 weeks of age and exclusive replacement feeding, or from birth to 12 weeks of age with exclusive breastfeeding, or birth to 12 weeks, and this is with exclusive breastfeeding. Then comes a role on the nutrition. There is a nutrition counseling which is given. So NC, that is nutritional counseling, is given, as well as a psychosocial support. So this is given in terms of the HIV infected pregnant woman. So in terms of the HIV infected pregnant woman. So we also ensure the CPT. What is the CPT? CPT is a co-trimoxazole prophylactic therapy. Co-trimoxazole. So it is nothing but co-trimoxazole prophylactic therapy. Prophylactic therapy. And an early infant diagnosis using the HIV DNA. And there is also the early infant diagnosis, and this will be using the HIV DNA PCR. So this is done at 6 weeks of age onwards as per the guidelines. So 6 weeks onwards as per the guidelines.